Now let's continue from where we left. That was breast milk jaundice. In this, enzymes are present in breast milk which break down conjugation between bilirubin and gluconic acid by the enzyme breast milk gluconidase. Now let's talk about how conjugated bilirubin is increased in the blood. First is defective gluconyl transferase. This is increased for unconjugated bilirubin blood. So for mistake, in this case, there could be mild deficiency of gluconyl transferase, which is called Gilbert syndrome. There could be moderate deficiency of enzyme GT, which causes Crigler-Najjar syndrome type 2. And sometimes there could be severe deficiency of enzyme GT, it could be completely absent. This leads to Crigler-Najjar syndrome type 1. Now let's talk about hepatitis. Hepatitis is inflammation of liver characterized by spilling of inflammatory cells from the portal triad to liver parenchyma. It increases both unconjugated bilirubin and conjugated bilirubin because there is impaired conjugation. And why conjugated bilirubin is increased? Because these damaged cells inflame and they block the canaliculi, so that then the conjugated bilirubin is absorbed by the blood. Now we have to remember that any type of hepatitis causes jaundice. Any type. Hepatitis A, B, C, D, E causes jaundice. Now, infective hepatitis can be viral, bacterial, or protozoa. Infected hepatitis of virus can be hepatotrophic because of hepatitis A, B, C, D, E, or non-hepatotrophic because of Epstein-Barr virus, yellow fever virus, or cytomegalovirus. Bacteria which cause hepatitis are spirochetes, Leptospira icterohemorrhagica. Because of protozoa, that is Toxoplasma gondii, which is from cats. So a newborn, when in a house, when a newborn is born, you should keep him away from cats because he can get in. They are more susceptible for getting infection by cats. Susceptible for getting infection by bacteria, protozoan virus. So you should keep him away from cats because then Toxoplasma gondii can infect him, and this can lead to jaundice in newborns. Now, fungi which causes jaundice is because of a toxin called aflatoxin. Now, non-infectious hepatitis. We'll talk about non-infectious hepatitis. It can be because of carbon tetrachloride, alcohol, some drugs, autoimmune diseases, or it could be ischemia of liver, or it could be Wilson disease. Wilson disease is because of increased amount of copper in blood. Now we have to talk about increase of conjugated bilirubin in the blood. It could be because of impaired transfer of conjugated bilirubin out of hepatocyte. One of them is Dubin-Johnson syndrome, in which you can see black liver due to decreased transport of broken down catecholamines. Another is Rotor syndrome. In Rotor syndrome, what happens that the transporters present in hepatocytes stop functioning, because of which conjugated bilirubin is stored in the hepatocytes. Now, primary biliary cirrhosis is an autoimmune disease directed against biliary canalicular system. So it destroys the biliary canalicular system, because of which conjugated bilirubin cannot go into extrahepatic biliary system. Now, some important facts. Every medical aspirant or a doctor should know is that all the autoimmune diseases associated with MSC class 2 are more common in females, and all the autoimmune diseases associated with the MSC class 1 are common in males. For example, ankylosing spondylitis. Now let's talk about graft versus host reaction, which can also cause increased level of bilirubin in the blood. One is patient because of tissue rejection and hemolysis, destruction of organ. So these can lead to development of rashes, bloody diarrhea, or obstructive jaundice. Now, for female, it is very important to know that they take this eye pill and all, so they should know the fact that increased estrogen intake or high estrogen level in the blood, for example, contraceptive pills can causes cholestasis, that is blockage of extrahepatic biliary apparatus. Now, obstructive jaundice can also be caused because of gallstone, malignancy of head of pancreas, ampulla of Vater, and one more important thing is because of ascariasis lumbricoides, which blocks the ampulla of Vater, preventing the transport of conjugated bilirubin.